Drugs targeting FLT3 have been under development for quite some time and were recently approved to be added to standard frontline induction chemotherapy and consolidation chemotherapy for patients receiving intensive curative approaches. So the drug Midostaurin, which is one of the older FLT3 inhibitors, initially was developed as a single agent and then found to be primarily more effective in the combination chemotherapy setting. And adding midostaurin to frontline chemotherapy has improved the survival of patients with both of the common types of FLT3 mutations, both the FLT3 ITD, which is established as a high-risk subgroup, and also the less common FLT3 TKD or FLT3 D835 mutation. Now, midostaurin is a good drug in that it improves their survival, but one of the problems with midostaurin is it's both not very selective against FLT3 and also it's relatively low potency against the target. And it's been known that there are drugs that can actually inhibit FLT3's function as a tyrosine kinase, both more potently and also more selectively. And the drugs that do that seem to have greater single agent activity. So a number of those drugs have come under development in the clinic. We're just starting to get data on phase 3 development of those drugs in relapsed and refractory patients. What you mentioned in terms of high risk, really the highest risk patients are those who have had prior therapy and then relapsed after it, or who never went into remission in the first place. Those patients are at very high risk of really poor survival, and these drugs seem to be both quite active in that setting and seem better able to bridge patients to transplant and ultimately to improve survival, as was shown recently on a phase 3 study of Quizartinib. Quizartinib is not alone in this regard. There are actually several drugs in development. Another drug called Gilteritinib has completed similar phase 3 development, and we should have the readout from that trial this year. There's a third drug called Crenolanib, and those drugs are all active in the clinic as single agents and are being tested in combinations now.